Okay, welcome to the deep dive. Today, we're plunging into a really personal collection of sources, articles, notes, forum discussions, all centered around the raw human experience of serious illness, caregiving, and while trying to navigate the healthcare system from the inside.
Yeah, think of it as pulling back the curtain, kind of moving past the clinical jargon to understand what these journeys actually feel like for individuals and families on the ground.
Exactly. We've got some reflections on lessons learned when health, fails, some incredibly powerful personal stories about palliative and end-of-life care, and even a forum thread lifting the lid on some unexpected medication side effects.
So our goal here isn't just summarizing.
No, definitely not. It's to give you a shortcut to understanding the surprising realities, maybe the hidden parts within these experiences. Let's jump right in.
Okay.
So, we start with reflections from those who've navigated illness. There was a blog post and the comments it sparked. And there's this really strong theme that while being sick is undeniably tough, it can also be, well, a profound teacher.
And what hits you immediately is how universally these lessons seem to land. The comments keep circling back to one sort of blunt truth. Nothing, absolutely nothing takes priority over your health, your family, and your friends.
Right. It doesn't just shuffle your priorities. It feels like it incinerates everything else off the list almost.
Yeah.
One person captured that feeling, talking about needing to slow down like it was a sign, almost a force from the universe making them hit the brakes.
It really makes you question our default mode, doesn't it?
Yeah.
This idea that maybe we often need a um, a seismic event just to realize the immense value of slowing down and focusing on what truly sustains us.
And then gratitude comes up. As suggested in those comments, a simple shift to being grateful for what you do have can radically transform your perspective when you're facing a health crisis.
Hmm. It's not just a nice thought, is it? It sounds like a vital coping mechanism. It pulls your focus from the difficulties and losses towards appreciation, which, well, it can be a powerful anchor.
And what's striking is how familiar this feels to so many people. That been there, done that resonance, it shows these aren't isolated insights. They're shared wisdom forged in the fire of illness.
Definitely. That collective experience.
Okay, moving from those personal reflections, we see how these challenges play out inside the system itself. Let's look at the Health Watch Bradford stories, which give us really granular detail on navigating care homes and hospitals.
Right. These accounts really expose the systemic pressures and maybe inconsistencies through the lens of direct experience. In care homes, understaffing was a huge point, especially it seems on dementia units.
And you see the direct consequence right there in the stories. Residents get bored and start kicking off because there's just not enough interaction or activities. The lack of outdoor access is particularly heartbreaking. One dad, I think, only got outside 3 times in under a year.
Wow. It highlights that care isn't just about basic physical needs, it's about quality of life, isn't it?
Yeah.
And these stories show a real mixed bag when it comes to care or quality. Some called damn good, others, well, not so much.
And the safety concerns are, frankly, terrifyingly real, too. There were details about falls that families had to chase up themselves.
Families noticing it, not the staff.
Exactly. And that absolutely shocking moment during a seizure when staff didn't even know where the emergency buzzers were.
Goodness. If we connect this back to the bigger picture, it just underscores the vital, often exhausting role families have to play in advocating and basically providing oversight within these places. They have to be constantly vigilant.
Switching focus to hospitals, those long waits in A&E are a frustrating constant. One speaker mentioned, what, 5 or 6 hours?
Yeah, that sounds familiar. And staff struggling too, often because of that same understaffing issue.
Although, interestingly, the stories show if you were visibly really unwell, say a drowsy child with a chest infection clearly needing a bed, you might actually bypass A&E altogether and go straight to a ward.
Ah, okay. So it shows the pressure points in the system maybe, and how urgent need can sometimes cut through the bureaucracy. But another difficulty mentioned was getting information from staff, especially later in the day.
Yes, trying to find someone in the evening.
And the delays in getting diagnoses or referrals, like that
Mhm.
delayed MDT meeting, that's a multidisciplinary team meeting where different specialists coordinate care that a GP had to chase down.
And then you get stories that they just gut you with their specificity. The mother with cancer of the esophagus who suddenly lost her speech.
Oh, that was, yeah.
The family's shock, wishing they'd been warned this was even possible, wishing they'd had that chance to say, I love you clearly, even though later She made noises they interpreted as those words.
That sudden, unexpected loss without warning is just a brutal reminder of illness's unpredictability. It screams the need for medical teams to have those difficult, proactive conversations with families, even about worst-case scenarios, so there aren't regrets like that.
Continuing with these really powerful accounts, let's delve into end-of-life care, whether that's in a facility or, for many, the desired but often complex setting of home.
The desire for dignity really runs through these stories, and for many, that includes the deep preference for dying at home. One person's simple statement just says it all. We all wanted him at home.
But caring for someone bedbound at home presents immense physical challenges. There's that detail about the sheer difficulty of lifting a dad from a double-divan bed, needing family members to physically prop him up.
It brings home the sheer physical labor involved in home care, doesn't it? And how much falls onto family members. Relying on external help, like an NHS night sitter, being absolutely crucial. One quote was, "We would have really struggled." It shows that families just can't manage this alone.
And pain management at home is described as this constant roller coaster, waiting for a nurse to, figure out a plan, delays getting medication, needing syringe driver top-ups. That's the device for continuous pain relief.
What's so palpable is the stress. Families describe repeatedly calling the district nurse and then being on a countdown as they wait for them to arrive before the pain relief wears off.
Yeah, that ticking clock feeling.
One person felt their dad was in unnecessary pain and agitation during those waits. Just awful.
Yet, amidst these immense difficulties, the sources also show moments of incredible resilience, unexpected turns, and truly brilliant support sometimes. The story of the child taken off a ventilator, only expected to live minutes, who actually survived 3 more weeks at home, even learning to breathe through the mouth.
Amazing. And the absolute lifeline of support described by the perinatal palliative care team coordinator would have been lost without her love and support and doctors who genuinely listened and actually incorporated family suggestions. It just shows the profound difference that compassionate, responsive care makes, enabling those precious, unexpected moments.
Definitely. Let's pivot now to the significant toll these situations take on the people standing by, providing care and support the family carers themselves.
Yeah, the stories here paint a picture of incredible fortitude under, well, extreme pressure. Family carers talk about just running on automatic pilot, often while somehow also managing work. You hear about working full-time and then spending evenings at the hospital just trying to get updates.
That balancing act sounds utterly draining. And then there's the often painful reality of social isolation. People describe friends or even extended family sometimes avoiding you because they simply don't know what to say around serious illness or dying.
Hmm. It raises a really uncomfortable question about how well we, as a society, handle discomfort around sickness and death, and how that adds to the burden on families. The contrast between someone who actively forces those difficult conversations and those whose partners or family members had no one really to talk to. It's stark.
And trying to navigate that when other family members are in denial, that just adds another layer of difficulty.
For sure.
On top of everything else, there's the sheer chore of constantly having to explain changing circumstances and share difficult updates, even when you're completely exhausted and just don't want to.
Beyond the emotional and social strain, these sources really lay bare the stark financial and practical impact. We heard that powerful example of financial collapse after bereavement, losing a car, being unable to pay bills, struggling to find a new career, not just any job, maybe facing ageism.
Yeah, that looking for young people comment was telling. Everyday worries like gas bills or car repairs filling your mind when you're deep in grief.
It shows how the practical stresses don't magically disappear. They just pile on top of the emotional ones. And this obviously has severe mental health consequences. The intense stress, the lack of eating, the lack of sleeping, tolerance levels just plummet, leading to increased irritability.
And there's that difficult but crucial realization that you might need professional support, that maybe you need to talk to somebody after pushing through and trying to cope entirely alone for so long.
Takes a lot to admit that sometimes.
But on the flip side, the sources do highlight moments of powerful support. 2 carers washing and dressing the body after death with dignity, the day hospice being described as a happy place for respite, bereavement support from children's hospices, the essential bedrock of family, friends, and neighbors.
Absolutely. But what really stands out, I think, is the unique, invaluable support found in connecting with other families who have gone through the exact same specific situation.
Yes, that peer support element.
They genuinely understand, in a way no one else quite can, offering a level of empathy and practical insight that formal support sometimes can't touch. That peer connection is such a vital thread across these experiences.
Okay, let's shift gears slightly and look at our third source, which zeroes in on a different kind of challenge within healthcare,
Yeah.
the hidden risks of medication. This forum discussion revolves around dopamine agonists, often used for Parkinson's, and some really severe side effects.
Right. What's immediately apparent is the scale and severity of the problem described by people in this forum. While dopamine agonists, DAs, are helpful for many Parkinson's patients, in a significant minority, the estimate mentioned was 15–20%, they can trigger severe, uncontrollable behavioral changes like gambling addiction or hypersexuality, basically a form of obsessive-compulsive disorder.
And the human cost shared by forum members is truly devastating. Lives being completely destroyed, people ending up penniless, homeless, even in prison, or attempting suicide, all because they weren't adequately warned about these potential effects.
It raises a critical question about informed consent, doesn't it? Patients and their families need to understand the full spectrum of risks, especially when they have such life-altering potential.
And this has spurred a push for action. There's a proposal to start a campaign, potentially called Kratos, to demand change. Their objectives are incredibly clear.
Yeah, they want 100% understanding of these risks across the board. Medical staff, patients, families, mandatory sign-off before anyone starts this treatment. And holding professionals accountable for negligence, specifically for failing to monitor patients taking these DAs.
They're also focused on identifying and helping current victims and pushing for public national statistics on these side effects. It's a powerful example of people turning their own trauma into motivation to protect others. Really powerful.
The forum discussion itself reveals some of the complexities, though. Members debate how realistically medical staff can properly monitor at all times, especially for patients living alone,
Right, that's a practical challenge.
with some suggesting maybe DAs aren't appropriate for those individuals at all.
And there's that tension you'd expect between those whose lives were, ruined and those for whom DAs are working well. But the call from the campaign is to move past that ping-pong debate towards collective action.
And importantly, this discussion did actually lead to tangible progress.
Yeah.
Parkinson's UK and local PDNSs, that's Parkinson's disease nurse specialists, developed a new assessment tool to help alert people to possible side effects. So it shows the power of individuals connecting and pushing for change.
Absolutely. Bringing all these different threads together then, these sources, though they're varied, collectively paint this incredibly rich and sometimes difficult picture of navigating profound health challenges.
Yeah, they constantly reinforce themes we've seen across all the sources.
Mhm.
The inherent unpredictability of illness trajectories, how quickly life can just flip upside down.
The crucial but often inconsistent role of the healthcare system and the individuals working within it, the frustration of delays bumping up against moments of brilliant, life-changing support.
And the immense, often hidden strain placed on family carers, the exhaustion, the isolation, the complex practical burdens, the mental health toll is huge.
Absolutely. And woven throughout is the critical need for clear, accessible information, whether it's doctors explaining potential medication risks upfront or families hunting for guidance online when the system maybe falls short.
It also powerfully highlights the absolute lifeline that support networks provide. Formal services are vital, of course, but there's a unique, indispensable strength found in connecting with others who have walked a similar path and truly get it.
That pure thing again. And finally, there's this undeniable current of advocacy running through it all. Families constantly having to be on top of things, pushing for better care, complaining when things go wrong, chasing information, or even campaigning for systemic change like better drug warnings. It shows the sheer resilience and determination required just to get needs met.
It really does.
So we've delved into some deeply personal and incredibly powerful accounts today, peeling back the layers of navigating serious illness, caregiving, and interacting with healthcare systems.
We've seen the unexpected lessons illness can impart, the stark realities of systemic frustrations, the heavy, often silent burden carried by families, and the desperate need for clear information and compassionate support, even when asking for or receiving that support feels incredibly difficult.
So what does this journey through these sources mean for you listening? It's a powerful reminder of the very human experience at the heart of health challenges, whether you're the patient, a carer, or interacting with the system. It underscores the vital importance of empathy, clear communication, and building robust support systems, not just for the person who is ill, but for everyone involved in their care.
And maybe consider this. These stories show how quickly life can change. How prepared are you and your loved ones to navigate a serious health challenge like the one described here? What essential conversations, maybe difficult ones, need to happen now before you ever find yourselves on that roller coaster?